It's my privilege. It's my privilege to present my uh, research, research study in front of you. So, let's start with the study in which the statement of the problem is the study to assess the effectiveness of yoga therapy in reducing the blood pressure among hypertensive clients in selected rural of Olpad, Surat, Gujarat, India. So, introduction of the study is a good health is a prerequisite of the human productive and development process. In the past, most individual of the societies view good health or a well as a opposite or a absence of the disease. Health is a multidimensional concept and must be viewed broader perspective. An assessment of the client's state of the health is an important aspect of the nursing. High blood pressure, also called hypertension, is a serious medical condition. It happens when the force of the blood pumps through your arteries is too strong. So, the yoga therapy is the adaptation of the yoga practices for public with health challenges. Yoga therapies prescribe specific regimen of the posture, breathing exercise, and relaxation technique to suitable individual needs. The challenges may be an illness, a temporary condition like pregnancy or a childbirth, or a chronic condition associated with old age or infirmity. Yoga therapy is a type of the therapy that use yoga posture, breathing exercise, meditation, and guide imaginary to improve mental and physical health. The holistic focus of the yoga therapy encourages the integration of the mind, body, and spirit. The modern yoga therapy covers a broad range of therapeutic modalities in incorporating elements from both physical therapy and psychotherapy. The need of the study. So, the globally, the overall prevalence of the raising blood pressure in the adult age, which is 25 and over, was around 40% in 2018. 17.3% people die from the cardiovascular disease. 80% of non-communicable disease that occurs in the lower and middle income countries. Internationally, in 2019, the age standard prevalence of the hypertension decreased by 2.6% in the high income countries, but increasing by 7.7% in a low and middle income countries. During same period, the proportion of the awareness was 78.2% versus 6.7%. Treatment was 44.5% versus 55.6%, and the control was 17.9% versus 28.4%. Increased simultaneously in the high income countries where awareness was 32.3% versus 37.9%, and the treatment 24.9% versus 23%. Increase less and the control 8.4% versus 7.7%, even slightly decrease in a lower and middle income countries. Overall prevalence of the hypertension in the India was 23.8%. Significantly difference in the hypertension prevalence were noted between the rural and urban part, which is 27.6%. Regional estimate for the prevalence of the hypertension were as follows, that is 14.5%, 31.7%, 18.1%, and 21.1% for rural north, east, west, and south India, and 28.8%, 34.5%, and 35.8%, and 31.8% for urban north, east, west, south, and western India. Represently, overestimate for the prevalence of the awareness, treatment, and control of blood pressure were 25.3%, 25.1%, and 10.7% for rural Indians, and 42.42%, 37.6%, and 20.2% for urban Indians. So the objectives of my study is to assess the pre and post test level of the of the blood pressure among the hypertensive client in rural group and experimental group, to compare the pre and post test level of blood pressure among the hypertensive client in control group and experimental group, to find out the effectiveness of yoga on post test level of the blood pressure among hypertensive client in experimental group, and to determine the association between the pre test blood pressure level among the client with hypertension with their selected demographical variables such as age, gender, educational status, occupation, duration of the hypertension, family history, and food pattern. So moving forward, the hypothesis of my study is the H1 is there is a significant mean difference in pre and post test level of blood pressure among the hypertensive client in experimental group. The H2 was there is a significant difference between the post test level blood pressure among the hypertensive client in experimental and control group. The H3 was there will be a significant association between the pre-test control and experimental group level of blood pressure among hypertensive clients with their selected demographical variables. The operational definition in the study was ASIS refers to the determined level of hypertension among the hypertensive client. Effectiveness. The effectiveness is the capability of producing a desirable result of the ability to produce desirable output. In this study, the effectiveness refers to decreased level of blood pressure among obtained after yoga therapy. Yoga therapy. So in this study, the yoga therapy is the pranayam which are Vastrika pranayam, Kapalbhati pranayam, Anulam pranayam, and Brahmari pranayam. Reducing blood pressure, it refers to reduction of the systolic blood pressure above 130 and diastolic blood pressure above 90 measured by using cuff and dial sphygmomanometer. Hypertensive client. The hypertension is the high blood pressure. Blood pressure is a force of the blood pushing against the wall of the arteries as it flow through them. Arteries are the blood vessels that carry oxygenated blood from the heart to the body tissue. It refers to the known hypertensive client with systolic blood pressure above 130 diastolic blood pressure above 90 between the age group of 36 to 65 years. Delimitation in my study. The study is delimited to only hypertensive client age between the 36 to 65 years in Talad and Ulpad village at Ulpad Taluka, Surat district, Gujarat, India. So here is the conceptual framework in which the figure 1.1 modified conceptual framework based on the Ludwig Bartholin 1968 general system theory, in which the input is demographical variables which is age, gender, educational status, occupation, duration of hypertension, food pattern, and family history. Then pre-test to assess the blood pressure using sphygmomanometer, pressure was 130 to 90, 160 by 100, in which the two group has been taken, in which one is experimental group and the another one is control group. In experimental group, the throughout was the yoga therapy, in which 4 pranayam were used. The duration was 30 minutes and the period for the 7 days. In control group, the no intervention has been given. In output, the post test has been taken, in which reduce or not reduce, and the feedback has been taken. In review of literature, total 20 studies were taken, in which the study related to hypertension was 7, the studies related to yoga was 6, and the study related to yoga on hypertension was 7. In research methodology, the research approach was quantitative research, in which research design was quasi-experimental research design, in which non-randomized pre-test, post-test design was used. Target population, client with the hypertension. Accessible population was client with the hypertension in Ulpad Taluka, Surat district, Gujarat, Surat, India. The sampling techniques were purposive sampling method was used, in which the 60 sample was taken, in which pre-test was done, in that the two group was made, in which experimental group and control group, in which 30 sample was divided. For the experimental group, the complementary therapy of yoga, the complementary therapy which is yoga therapy was given for the 7 days of 30 duration, and in control group no intervention was there. So in the post test, the analysis and the interpretation, descriptive and inferential statistic was used. Then analysis, interpretation, and written report has been done. The data was collected through the sphygmomanometer. In variables, the independent variable was the independent variable was yoga therapy. In independent variable in the study, the dependent variable was level of blood pressure. In demographical variables, the age, gender, educational status, occupation, duration of hypertension, food pattern, and family history had been taken. The sampling criteria, in which inclusive criteria, clients who are diagnosed as a hypertension, the client who are hypertensive client, the client who is having the age group of 36 to 65 years, the client whose blood pressure level is between 130 to 90 and 160 by 100 mm of Hg. The participant was taken who are willingly to participate in the study. In exclusive criteria, the client are not willingly to participate in the study, or the diagnosed as a hypertension with other medical conditions such as cardiovascular disease. The tools was made in this study was section A. Section A explained that the socio-demographical variables, and section B was sphygmomanometer. The scoring procedure was made in which the normal, elevated, high blood pressure and high blood pressure stage 2 was taken. In data analysis and interpretation, the demographical variables was the first demographical variables was age group, age in the year. The maximum percentage was 43.3% in age group of 56 to 65 years in experimental group. The second variable was gender, in which the highest percentage was 53.3%, in which females were there in the experimental group. The third variable was occupation, in which moderate worker was in the highest priority, which is 43.3% in the occupation. The next the next demographical variable is food pattern, in which the non-vegetarian consuming client was there, in which 73.3% was the highest percentage of the experimental group. Then the client with the hypertension having the since 6 months in the experimental group was 46.7%, and also in control group was 46.7%. The next demographical variable is education, in which 100% literacy rate was found. The next and last variables is family history, in which heredity were there, in which 73.3% was in experimental group. So here is the data in which the table 4.1 frequency and percentage wide distribution to assess the effectiveness of yoga therapy in reducing the blood pressure among the hypertensive client in selected rural area of Kolpad Taluka, Surat district, Gujarat, India. In experimental group pre-test score depicted that the majority of hypertensive client is 18, which is 60%. Client having stage 1 hypertension, 20% have pre-hypertension. The 6, which is 20%, have stage 2 hypertension. And in the post-test score depicted that the majority of hypertensive client, which is 12, which is 40%, client having the pre-hypertension, 9, which is 30%, having the normal blood pressure, and 9, which is 30%, having the stage 1 blood pressure. In control group pre-test score depicted that the majority of hypertensive client, which is 17, client having the stage 1 hypertension, the 7 having the pre-test hypertension, the pre-hypertension having stage 2 6, which is having stage 2 hypertension. And in pre-test score depicted that the majority of hypertensive client, which is 10, having stage 1 hypertension, 5 having stage 2 hypertension, and 4 having a pre-hypertension, and 3 having a normal hypertension. It is a graph showing that the hypertensive group and the control group, in which pre-test is having the 20, 60, and the another was post-test, in which 30, 30, 40, and 90 graph was shown. Table 4.5 PET test was found in the experimental group to assess the effectiveness of yoga therapy in reducing the blood pressure among hypertensive clients in selected rural area of Olpad Taluka. The table depicts that the comparison between the pre-test and post-test score obtained by the sample of yoga therapy in hypertension among the hypertensive client. The mean pre-test score was 2 and the post-test score was 1. The mean difference is 1. The table also depicts that the standard deviation of the pre-test, which is 0.64, and the standard deviation of the post-test was 0.79. Hence, research hypothesis is accepted. Table 4.6 unpaired t-test was found between the control post and experimental group to assess the effectiveness of yoga therapy in reducing the blood pressure among the hypertensive client in selected rural area of Olpad Taluka, Surat district, Gujarat, India, in which the table 4.6, the mean experimental post test was 1 and mean control group post test was 1.83. Mean difference between the pre-test and post-test score was 1. The table also depicts that the standard deviation of experimental group was 0.79 and the standard deviation of control group post-test was 0.83. The table also calculates unpaired t-test is 3.97, the high, which is the higher than the tabulated value, which is 1.699. Hence, the research hypothesis is accepted. The table 4.7 association of level of blood pressure in the experimental group in pre-test in selected demographical variables in which the gender, and we can clearly see that the gender and food pattern is significant. So, in the summary, the discussion and the summary, the quantitative evaluative approach with a quasi-experimental design was used to determine the effectiveness of yoga among the client with the hypertension in the selected village. The conceptual framework was based on the general system theory of Ludwig von Bertalanffy in 1968, as explained by Newby in 1996. The tool used in the study consists of two parts. The part 1 is a demographical variable and the part 2 is the yoga therapy. The simple randomized sampling techniques is used to collect the samples, and the data was collected from the study participant in the experimental group and the control group. The data were collected and analyzed by the descriptive and inferential statistics. The level of the significance as assessed by P is greater than 0.05 in the test of hypothesis. In implication, the nursing educator need to be equipped with the adequate knowledge regarding the yoga and hypertensive client. The next one is nursing students should receive adequate training and regarding a benefit of the yoga. Conduct workshop and conference for the student regarding the benefits of yoga for hypertensive client in day-to-day nursing practice. In nursing administration should be initiative to introduce the periodical and a service education program in order to minimize the complications of the hypertension. Nursing administrators should emphasize and encourage the staff regarding the practice of the yoga. Nursing administrator can also organize conference, seminar and workshop for the nurses to encourage the practice of yoga for the home and in hypertensive client. Nursing research. Nurses should conduct the research to further clarify the benefits and optimal association of yoga for hypertensive client. Nurses can also encourage further research to be conducted regarding the effectiveness of yoga for hypertensive client. Disseminate the findings of the research through conference, seminar, and publication in nursing journal. The recommendation for the study: the following studies can be undertaken: the strengthen yoga on the reducing hypertension to decrease the hypertension level as a good remedy for hypertensive client. A similar study can be conducted with the increase in the sample size. A similar study can conduct among the another hypertensive client. A similar study can be conducted in a various community settings. So these are the images which was collected in my research study. Thank you, all of you, for listening patientfully. Thank you to the dignitaries who have given me the opportunity. Thank you to the organization committee. And I also like to thank Dr. Alka Tajne, Professor Alka Tajne ma'am, for giving me the opportunity on behalf of her.